Hi, this is CEO Talks from Forbes Vietnam, where we dig into the unique stories of how some of the best known and most successful companies, innovators, and entrepreneurs came to be. The past 2 years since the global pandemic happened, the world's attention has been shifting, focusing more on finding emergency vaccine that people need. In that time, the traditional vaccines market is kind of decreased and being neglected. Today, we are going to have a conversation with one of the world's leader in vaccine, a company called Sanofi. Sanofi has been in Vietnam for more than 60 years, and the vaccine industry itself is 30 years. And they have more than 1 billion doses of vaccine per year to help protecting more than 500 million people from dangerous infectious diseases. Today, I have the honor to interview Mr. Fabrice Baschiera. Thank you very much for being here.
Thank you very much, and I'm very pleased to be here with you today.
When did you come here at this trip?
So I arrived yesterday.
Yesterday?
Yes.
How long are you going to be here for?
I'm going to be only for 2 days. It's a short trip, but very important one. I wanted to come to Vietnam since a long time, actually, because we see the market dynamic is absolutely amazing, and I really wanted to be here to understand what's going on and see how Sanofi can support the fast development of the country. Great,
great. There are a lot of players here, but what we learned, what we've seen, Sanofi has been very committed in Vietnam market. On that note, we've been witnessing a lot of pharmaceutical giants around the world racing to find the cure for COVID-19 before. With the coronavirus happening for the last 2 years, in your opinion, how has it changed the whole industry?
So I think we can see 2 or 3 major trends that happened since the COVID crisis. The first one, you notice that when you have such a pandemic, a global pandemic, you see that all the actors are working together in order to find a solution. And we also noticed that this is not one company or one actor who can find a solution for this situation. So what we have noticed is a strong, I would say, increase and reinforcement of collaboration, which has been public-private or private-private collaboration. And this is where we have been able, as an actor of the industry, to provide support and hopefully solutions. Of course, I'm talking about vaccines that I think are helping the world today to be protected against COVID vaccination infection. So I think that's important because this collaboration have been noticed at a different level. Of course, from R&D development, Sanofi also collaborate with GSK in order to develop their COVID-19 vaccines, which has been recently approved in Europe, actually last week, so it's very recent news. It took us a while, but it was very important to develop these vaccines in order to have an alternative option and solutions for people who are at need of the booster COVID vaccine using a different technology, because it's a recombinant technology we are using for other flu vaccines that we are manufacturing around the world. This kind of collaboration never existed in the past. So I think this is, I would say, a positive aspect of this pandemic, that at least people understand that we are and we can be competitors, but in front of a major disease like this, we need to collaborate and we need to be partner before being a competitor. So I think that's a first major change that I've noticed in terms of the way we are collaborating all together to fight against this pandemic.
I think that's a wonderful spirit in the medicine and pharmaceutical industry, that when a crisis like this happens, a pandemic like this happens, everybody puts their head together to find a solution for the cause.
So the third trend we are observing now is the fact that we see a much better access to vaccines than before COVID-19 situation. A lot of countries realize around the world that the access to vaccination was complex, was lengthy, and was not easy for patients. They have to go through physicians, to pharmacies, to vaccination centers, which makes the access to vaccines difficult, lengthy, and sometimes also costly for the people. So we see 2 trends. Some countries are opening now vaccination centers all across the country, which is what we see actually today in Vietnam, which is easing and facilitating the communications, understanding of the people for vaccines, and I think reassure them about the importance and the benefit that vaccine is bringing. They can meet physicians, they can meet nurses who explain what's going on, and I think this is increasing the confidence of the population, helping to increase the coverage rate. The second thing that we are observing is what we call the PBI, the pharmacy-based immunization. A lot of more and more countries realize that they already have a very good network across the country beyond hospital or doctors' clinics, which is pharmacies. So they are now allowing the pharmacists to directly vaccinate the population. This is a new trend we see now in Europe. France was one of the first countries in Europe to allow pharmacies to vaccinate. We see more countries now following this trend. Germany is now starting a pilot into this area. And I think that more and more countries are going also to follow this trend. This is increasing access, proximity, reducing cost, which is what we want today in a world where I think vaccines will be more and more present to protect the life of more people.
It sounds like this is not just finding a solution to cure the infection of COVID-19, but it's something more long-term. Has Sanofi done anything to prepare and learn from this pandemic to prepare for the next one?
For sure.
Hopefully not seeing the next one coming, but I think we have to plan for it. So
right.
What's your thoughts?
So I think we also realize that if you want to be vaccine leaders, you need to have and develop different technologies. Having one or two technologies are not enough. You need to have a large variety and range of different technologies, allowing you then to develop and manufacture different vaccines. Of course, mRNA has been, and is today in the mind of everybody, because that's the latest recent technology will help us to bring COVID-19 very quickly to the public and to the market. However, we think that we need to have a different technology which are also recombinant, active or inactive vaccines technology that we have at Sanofi. However, we have decided to accelerate our investment in mRNA technology. So in 2021, we have decided to invest in mRNA technology. We opened a center of excellence, one in Boston and one in France, in order to develop ourselves our own technology. It's an end-to-end investment, which is about 400 million euro each year, in order to being able to become a leader also in the mRNA space. And we have added this technology into the other technology that we had together. mRNA is a very important and very innovative, I would say, solution, but this is not the only one. Bacteria, combination vaccines will not be the right solutions for mRNA. They need other technologies, and that's why we are now adding this technology on top of the other one. The second decision we've made is the fact that if we want to be able to respond to a pandemic, you need to be fast, not only in terms of R&D, but also in terms of manufacturing. That's why we have decided to open what we call evolutive vaccine facility, which is a brand new way of manufacturing vaccines. The traditional way was, in order to have one vaccines or one strands, you need to have one factory dedicated for that vaccine, which makes the evolution and the agility of manufacturing very, very difficult, because you need to redevelop manufacturing site for one vaccine, register manufacturing approval, going through the process, which takes many, many years. We cannot have that anymore. We need to be much more agile. We need to be much more able to adapt our manufacturing footprint to the future evolution of infectious disease. And we cannot predict what or which will be the next outbreak, unfortunately. So we have now these new facilities, one in Singapore and again one in France, which will allow us to have in one factory the possibility to manufacture several vaccines at the same place, and having the possibility to switch from one vaccine to another one very quickly, allowing us then to adapt and adjust our manufacturing situation to the pandemic or to the need of vaccines, which can evolve over time depending on how the infectious diseases are evolving around the world. The second one is we need to anticipate on the longer term. vaccines is not a pharma product that can be manufactured overnight. The quality system that we have in place also take time to make sure that the vaccine we are producing are not only effective but also safe. And that's why we need to work and collaborate on a long-term manner with countries or with a government who are willing to purchase in advance the vaccines. The longer term and the better visibility and predictability we have, and the more we can avoid having supply issue, avoid hiccups, and that's why we need in the vaccine industry. It's a long life cycle industry, and we need long-term and predictability in order to ensure we supply the vaccines where it's needed.
So, of course, we've been talking about these things. I just want to clarify, this is beyond COVID-19 vaccines. There's different type of vaccines. So what are the biggest global health problems that companies like Sanofi trying to address through vaccine?
So I think the first, or I would say the major issue we have observed after COVID-19 is the reduction of the vaccine coverage rate. Why? Because there is a very much focus on COVID-19 vaccination, and unfortunately during this time we tend to forget about the other disease because the priority was given to COVID-19. So we have observed a reduction of the coverage rate for basic but very important vaccinations, like the pediatric vaccinations, like you can notice for polio, for pertussis, where we start to see a rebound of the disease in different parts of the world. This is a major concern for us because we know that from the WHO recommendation that if you don't vaccinate babies more than 4 months without vaccines, then you see this pediatric disease coming back very strongly. And we know how deadly and damaging can be this disease. So when we notice that, we work together with public actors, with governments, to reinforce the importance of not only looking at protecting the population against COVID-19, which is of course a priority, but also with other disease. So flu vaccination has decreased, pediatric vaccination has decreased dramatically as well, and which is a concern for us, and that's why we work very hard over the last 2 years to make sure that we are now coming back to a good level of protection to avoid that other diseases are becoming a future threat for the humanity. So this is one area. The second area that what we have noticed is the need of new vaccines. We still have disease and virus that are spreading around the world, and one that we have now today where we have a major outbreak is RSV, respiratory syncytial virus, which is a respiratory disease for newborn, for babies. And today there is a major outbreak in developed countries, in Europe, in US, but coming also in other parts of the world. And thanks to what Sanofi has done, we collaborate with AstraZeneca in order to develop a new technology, a monoclonal antibody, which will allow the babies to have a specific protection against this disease. This vaccine has been just recently approved, actually in Europe, in US very shortly, and then in the rest of the world in the near future, which will again provide another protection against a disease that could be very damaging and deadly for newborns. So this is what I think a company like Sanofi needs to do to continue relentlessly to invest in new vaccines, bringing innovations to protect more people.
You talked a little bit about having these two manufacturing facilities. One is in France and go back to the one in Singapore. In Singapore, and then try to expand production into Vietnam. Could you share why choosing Singapore and what the benefits are there to be in Singapore? So
we were looking for an area in this part of the world in Asia where we can find right locations, right facilities, the right support also in order to build this manufacturing. So we contacted several countries, and Singapore responded very positively, supporting us in terms of funding, tax support, having the land also in order to build these facilities, and that's why we decided to work with Singapore. The technology is also present, so we can find the right expertise, and because we need to have expert workers to make sure that these vaccines can be, facility can be operated on a high quality manner. And we also have a long history of collaboration with Singapore, but we have no manufacturing of vaccines in this country. That's why we have decided to operate and to have our manufacturing in Singapore.
What capacity is there in Vietnam? What is the operation here?
So we have a long history in Vietnam. Sanofi is present in Vietnam for more than 60 years. We have in Vietnam not only a commercial organization, but also medical R&D and manufacturing. We used to have several manufacturing sites here in Vietnam, and we decided to merge them together to build a more modern one, where we are producing consumer health products for Vietnam, but not only. We are manufacturing product that we are exporting. Vietnam is for us an Asia hub. We are commercializing lactacid, Telfast, Corbière Calcium, and other famous brands in 11 countries in Asia. So this is a very important strategic location that we have reinforced even further with this new manufacturing site that we have opened a few years ago. And we are now reinforcing this presence by having an export hub where we can show that products made in Vietnam are very good ones, have international quality, and are today used by more and more countries.
So, speaking of Vietnam, you used to be here 20 years ago. Right? So, let's talk about the vaccine market, the regulations that you work with the government as an FDI coming in Vietnam. How has it changed since the last time here 20 years ago and today? What's the market looks like for you?
So, first of all, this is the first time I come back to Vietnam since I left, as you said, almost 20 years ago. So,
well, welcome back.
Thank you very much. I'm very pleased to be here. I mean, what I've observed over the last couple of days is amazing. The progress that at least Ho Chi Minh City went through are amazing. When I was here 20 years ago, there was no high building. The infrastructure was not as good as it is today. There is only mainly motorcycle. Now we have a lot of cars. So we see how the country has developed. And that's what I can observe right away when I arrived yesterday. But what I have noticed also is the improvement of healthcare, which is also absolutely amazing. You see that there is a very strong willingness, both from the public and the private actor, to improve the quality of care, to facilitate the access to more people regarding traditional pharma and medicine or vaccines. This is something that I've noticed also in the last 2 days. What I can say is not only you see an access of care, but also the quality of medical education, the disease awareness, the communications to the public and to general public about what are the vaccines about, what are their diseases about, and how they can then better understand why they need to protect themselves, why they need to go to a clinic or hospital. It's really amazing. We can really see an evolution over the last years. And I was looking at and comparing countries with other countries, and the evolution of the access to vaccine, which is of course very interesting for us. I think it's the fastest evolution in the world over the last 3 years. It's really huge. Of course, it depends where you come from, but at least you see this very fast investment and evolution in vaccines in Vietnam, which is really great. From a regulatory standpoint, we also see major progress. We see that there is a very strong willingness from the government to increase access to innovations, to facilitate the registration, and I can only encourage the government to continue into that direction, to continue to support and facilitate access to new vaccines, access to innovation, because this is the best way to protect more people, to protect the life of more people, especially when you have a so active economy where people need to be healthy as long as possible in order to contribute to the economic development of the country. So I really encourage Vietnam to continue on the same trend, continue to invest in infrastructure, invest in the regulatory bodies, to have the possibility and the chance to bring more innovations to more Vietnamese people.
You talked a lot about this depth of R&D in the vaccine industry. How long have you been in this industry?
So I am working for Sanofi for more than 27 years, actually. I had a chance to live in 8 different countries, work in these different countries, including Vietnam, which was actually the first country I live in Asia. And then we fall in love with my family of Asia, and then we decided to stay, and we stay 15 years in working in 5 different countries across Asia, which has been something I think that is having a deep impact on the way I see my role as a leader for healthcare and the vaccine companies, because our objective and my objective is, of course, to provide the largest number of vaccines to the largest number of people. 1 dose of vaccines that we are able to provide and to sell is 1 life protector against a disease. So this is something that I find extremely motivating. That's why I'm still very energetic. That's what I like very much what I'm doing, waking up every morning, because I know that what I'm going to do, the decision that I'm going to make with my team are going to have a positive impact of the life of millions of people. And I think this is, for me, extremely high motivating reason why I'm still working for Sanofi. I'm still working in vaccines because I know that the purpose of what we do as a company and as an employee and the leaders of this company will have a great impact everywhere we go. And that's, I think, why we are working so hard. This is our role and responsibility.
Over the course of 27 years, could you share a story of which market that you have an exciting or insightful or interesting story about that market that you built?
Let me give you one example. I work after Vietnam in China, which we know is also a very large country with a lot of unmet medical need. When I was in China a few years ago, all the multinational companies were focused on the large cities, on the large area, because we think that this is where companies can have a reasonable economic, viable, long-term position and situation. And then we start looking at what are the real medical needs. So we went to what we call the county, which is the countryside outside of the big cities. And we realized that actually the need to and the access to efficient and quality medicines and vaccine was very, very poor. So we decided to create a small team in order to start to investigate and assess if there is something we can do about these areas, if we can help in terms of not only providing medicine, but also providing medical education, support to the community. And after a couple of years, we had more than 2,000 people working in this area, where we are able to bring new products and new vaccines to the people who have no access in the past to a multinational and innovative product. I remember visiting one of these county hospitals, and the team there was looking at me like if I was an alien. You know, they have never seen a foreigner coming to their hospital, and they was asking, why are you here? You know, what are you doing here? And I told them that I am working for a company who is looking at where are the medical needs, where we can have an impact, where we can help people who are at need of quality of care. And this is what we have done. We provided now this access, this support, and we are very pleased that it's representing a significant part of the activities and the business of Sanofi in China. What we see happening in Vietnam is moving to the same direction. The big cities are well covered, infrastructure is well done, but what we see more and more is how can we develop and support the rural area, the countryside, where I think the middle income population is increasing and is looking for better access, high quality product, high quality vaccines. And this is what we are now also starting doing in Vietnam, supporting the populations and the medical actors who are trying also to bring vaccines and quality care to the rest of the country.
How long ago was that when you were in China?
It was not a long time ago, actually. I left China in 2013.
2013. So now Vietnam is kind of you see the future that's kind of following similar pattern.
Yes, and even faster actually. The pace is faster in Vietnam now.
Wonderful, wonderful. Well, Fabrice, it's a pleasure to have you with us. Thank you very much for your time and enjoy your trip.
Thank you very much.
Thank you.
Thank you.